Good morning, everybody. Thanks for joining us. We're just waiting for more people to join us, so I'll give it a couple more minutes before we make a start with the presentations. Thanks for your patience. Good morning again, everybody. Again, just waiting for a few more people to join us. We're kind of almost there now with the people that had registered, so just give it a bit more time. Appreciate people are probably moving between meetings, etc. So just bear with us a few more minutes. Thank you. Well, good morning, everybody. Thank you for joining us this morning. My name is Chris Booth. I'll do some introductions in a second to our guest speakers, but this morning we want to share with you some more information around a very topical subject, that being ensuring patient safety by maintaining a secure and vigilant IT estate. A little bit of housekeeping. If you do have any questions, please drop them into the question box. We will try and answer them if we've got time. We obviously want to try and keep to the kind of deadline that we set ourselves, and everybody's busy. And as you leave the session this morning, there will be a short survey. Just helps us to kind of make sure we keep the right content in these as we do these. I would appreciate any feedback you've got. Obviously, you can contact us outside of that via any emails that you want to send us in with any other questions from there on in. So that's great. And again, thank you for joining us this morning. Just by way of initial introduction, so I'm Chris Booth, Healthcare Account Manager from IT Health. I've been working in IT security and within the NHS now for about 25 years. I'm going to be joined this morning by David Willis. Good morning, David. And also,
and as with all live events, apologies for not finding the mute button quick enough.
That's fine. That's fine. Don't worry about it. And good morning, Craig.
Good morning.
And you can probably appreciate we're all on from different parts of the country this morning, so we'll do more introductions when we get to the sections for David and Craig. But it's a real privilege to have them both of us this morning. And thank you for your time, gentlemen. Just by way of introduction, IT Health, if you've not come across us before, we're actually celebrating our 30th birthday this year. You may have saw that on the first slide. And we spent the vast majority of that working within IT security within the NHS. We work with a wide range of organisations, as you can probably expect, and some of those we've been working with for over 20 years. So we, as far as we see, it's our experience that kind of sets us apart in terms of knowledge of what we do, but also what you do, and getting into that deep understanding and relationship with our customers. Some of the things that are on the screen at the moment in terms of things that we do on a day-to-day basis. And again, if anybody's got any questions on any of this content, then by all means get in contact we can talk to you more about that. We work with some of the leading vendors in the market. I'm sure you recognise all the names on the screen at the moment. And you know, it's important to us that we work with best of breed solutions, but it's not just about taking those products and just kind of looking at them in terms of what they are. It's about how we implement them. It's about how we integrate them into your environment. It's about how we make them work for you, and that's the key thing for us that we do. We have two of our own solutions. We're going to talk about one in a second. That'll be in our IT assurance dashboard. But we also have a secure access remote VPN solution called Secure IT, which is quite widely used actually. And like most things that we do, we kind of design solutions with you, for you, and for use within the NHS environment. So that's a quick intro for us. Again, any questions on that, please shout up and get in contact with us. It does, however, give me great pleasure to introduce David Willis. I've been working with David now for probably the last 5 or 6 years in different roles. I'm just going to pass David keyboard and mouse access so we can go through his own slides. But David, over to you. Thank you.
Okay, thank you very much, Chris. So as the slide says, I'm David Willis. I'm acting Senior Information Security Officer for Lancashire and South Cumbria Health and Social Care Partnership. I've been involved in security for so many years, and I've actually been working in the NHS since, I was trying to figure it the other day, whether it was 2003 or 2004. So I started in the NHS on the national project for IT, working for Accenture as a security analyst for the North East and East Midlands national data centres. Since then, I've worked for CSC on the same and similar projects. I've worked in primary care, I've worked for strategic health organisations, I've worked for mental health trusts, I've worked for primary care trusts, and until April of this year I was working in Greater Manchester as the head of cyber governance and assurance. Now, sector experience prior to the NHS, just about anything you care to name. I also spent 9 years running my own company, sort of doing electronic data capture, so converting your paper documents to something that's electronically readable. So if you have an older Ford car and they put that little screen up that shows the exploded view of the engine compartment and the bits, we probably did that, and we did the same for Dixon's and Curry's and far too many companies to name. There's a bit of delay on these slide changes I'm finding, so and finding out whether I'm pressing the right key doesn't help either. Is it going to change? This is where it bounces forward 3 or 4. Chris, have I got control of the slides?
Yeah, you should have, David. Yeah, you have. Yeah.
Okay, so I'm pressing things and things ain't happening. See if that helps. Might be an idea to take control, Chris, and just flick through them. Yeah.
There you
go. Okay. So these slides, when I put them together for in response to Phil. I don't know how many of you are aware the NHS now has a Chief Information Security Officer, a chap called Phil Huggins. And Phil Huggins did a similar set of slides where he asked various questions about what's going on. So I kind of designed these slides in a similar way. And Chris thought the scope of his role was primary care, secondary care, social care, and the alphabet that is the NHS. But obviously from my perspective, it's not just all of those organisations, but our entire supply chain, all the organisations that we work with at a partnership level, and all those organisations that might be able to help us not just change the lives of people who rely on us for basic patient care, but can help us defend and deter attacks against the NHS. My current scope is bringing the security people of the health economy together, getting them to work as a team, prioritising digital defence, looking at risk, looking at system-wide architecture, looking at workforce, trying to engage with the front line, setting expectations, finding guidance, getting support in place, trying to help some of the funding, and liaising with the guys at the top who because they're sat above so many health organisations, don't always understand the challenge on the ground. Chris, next slide. So to understand that sort of thing on the ground, you really do need to understand how the health economy is made up. And we talk about an NHS, and it's made up of 3 components. The first being primary care, so all of those. They generally have support from a clinical support unit for their tech, but these days that support comes from secondary care organisations as well. It's complicated. We've got all these types of trust, plus of course we have foundation trusts and private healthcare companies. And we of course have that lovely bane of social care, which the NHS doesn't deliver. We commission from councils, we commission care homes, charities, police, fire, are all involved in social care. When you look at that, you see the brown, you realise that actually all of those are private companies. The NHS isn't a single business. All of it's of course regulated by the Care Quality Commission, who until about 5 years ago weren't really interested in digital, but are now showing interest. Historically, we've had clinical commissioning groups sat above primary care and secondary care, and then strategic transformation partnerships in some areas, but not all. We have NHSD sat providing digital solutions, then we have NHSX commissioning digital solutions, and NHSE and I commissioning the actual care of patients. So above this and governing the whole lot is the Department of Health and Social Care. And it's kind of important that you understand this, because when people start saying that it's the NHS isn't a single business. It's made up of hundreds, if not thousands, of private businesses and some NHS organisations that are sort of led by NHS England. It's a very complicated system on the ground, and every one of those primary, secondary and social care providers have their own priorities, some of which, when it comes to social care, isn't necessarily around social care. It can be around a whole load of other services that they're providing to the public. Chris, next slide. So where do I sit? Well, I sit in the Northwest, Chris, specifically section 4. We're beginning to formulate as an ICB. So for those of you who don't know, the CCGs are all kind of going to disappear. There will be ICBs. There will be dozens of them across Britain. Some of those ICBs will effectively just be same old CCGs, but bigger footprint. However, some of those ICBs, and mine is one, it won't just be commissioning services from others. We will be supplying digital services because that's what we've been doing for years. So within that little area, we've got the place-based working sat around Morecambe Bay and Pennine and our acute and council partners. We've got 4 councils, 1 mental health trust, 4 acute trusts, 200 GPs and a population of about 1.8 million people. Chris, next slide. So my part in this is a small part. I actually quite like this slide because although I'm a senior information security officer, not a chief information security officer, when you have a look at this particular slide, you begin to get an idea of what you actually need to do in order to protect your digital assets. And I'd say about half the protection you're doing is based purely around technology, whether that be your cyber people, whether that be your IT security people, whether that be your SOC if you're lucky enough to have a SOC, whether you've got technical solutions to help you secure the supply chain, but then you've got your legal and compliance, your risk, engagement with your board level, you've got your HR and OD, organisational development, providing training, not just for your IT staff, but for staff across your organisation. And of course, all the time this is happening, we're putting new digital solutions into our organisations at a rate of change. And whether or not we've actually got the wrap around those particular solutions is a difficult call. We're also moving away from the traditional, we'll in-house have this in a trust or organisation data centre. We're moving into the cloud as well. We're bringing in new endpoint technologies every day and keeping track of all this lot using historic methods with a chap wandering around with a clipboard, or actually up to about 4 years ago when they started giving people laptops to do this kind of stuff, is hard work. We have to have digital technologies in place to help us for all these components. The bigger challenge, of course, is that this is just my game board. This is just one view of how the NHS works. If you could imagine this to be a Rubik's Cube and sort of like turn it, you'll suddenly see all the clinical stuff that's absolutely vital, because that's the frontline service we deliver. If you're in secondary care and you turn it, you're probably going to have finance and all the people that say you can't have money to do stuff, or you can have money to do stuff, and these are the rules about what you can and can't spend it on, and this is the type of money it is. Rotate it again and you've got your estates and facilities, and without your estates and facilities, where are your clinicians going to work from? And that Rubik's Cube is really complicated, because every one of the bits on that Rubik's Cube is going to be running digital systems, and every one of those digital systems needs some oversight from you guys and the tooling you're using. And every single one of those bits will at some point implement some new technology, or it will need to be patched, or it will need to be retired and replaced, or it'll go into the cloud, or it will come back from the cloud. And keeping track of those digital assets is challenging. Next slide, Chris. Now, when we start talking about the business and we start talking about digital, the thing that we tend to miss is digital is just an enabler for something else. Digital enables frontline clinical care, but digital enables the movement of information to a frontline clinician. Now, I spent 6 years as head of IG at an acute trust, and the one thing that we always had from IG was confidentiality, confidentiality, confidentiality. And one of the things that always struck me is that we never actually had a look about the impact that we as an IG department had, not only on the business but on our patients, through just pushing that picture of confidentiality and data protection. So I spent probably the best part of a year each month going through all the actual incidents the organisation had. And what I did is I split it into confidentiality incidents, availability incidents, and accuracy incidents. Now, I particularly chose accuracy for 2 reasons. One, people don't understand what's meant by integrity, and integrity is quite specialist. And 2, my audience, the CIRO that was the first person that looked at this, he was the finance director. Integrity, I don't think he understood the term in the terms of digital data. Accuracy, he understood. But when we started pulling together the numbers and we realized we were getting 25 information incidents a week on average, and as those, a percentage of them led to actual patient harm, we started changing the conversation within our organisation. When we started looking at this from the perspective of actually each of those incidents costs us money to put right, we started changing the conversation. We started giving people the awareness that the information that your digital technology is delivering is fundamental to the operation of the business. That's a conversation we still need to have. That conversation is still not there. And I really wish it was easier to actually pull this information out of the records to give boards awareness of the impact that ignoring information has upon their organisations. Chris, next slide. So here's a little bit more information for you. When I'm looking at sort of the security of health and social care, I'm not looking at it from a single secondary care provider. I've got to look across the whole economy. So we're changing the way we structure the economy. We need to change the way we look at the health economy. It's not just about an acute trust or 2 acute trusts. But when we start pulling real data together, we can start comparing how organisations are working. So when we have 2 NHS trusts in my patch, one of whom is significantly better than others on their ATP exposure scores, one of whom is significantly worse than others on their server exposure score, some of which haven't even actually rolled out ATP to their servers. We can start getting a bit of a picture about what the health economy looks like. And it's important that we have this picture because all these organisations need to work together to share information about patients and their business in order that the health economy can work. But if you go to any of the IG people in any of those organisations, the first thing they'll say is, how can I trust another organisation to share this information that I hold, because I've got the legal liability if it all goes wrong. Now, all I have here is the DSPT returns, which are publicly available, and the ATP data. I don't have access to anything else as yet, but the sort of digital tooling that Chris can point us at starts giving us a much richer environment that we can look at. It gives us data that we can drill into to find out whether or not we're actually maintaining things properly. One of the challenges that we do have in the NHS is the people at the top see these numbers and they see the numbers in the boxes and they start shouting. But what they don't necessarily realise is that behind each of these numbers, there's a narrative. And from a top-down approach, it's very difficult to actually get in control of that narrative and to get that understanding as to why you can have two NHS trusts with such different Windows exposure scores. Nationally, it would be just a jump up and down at the person in the red and telling them to get it sorted. But actually, it could be much more complex than that. It could be that the board isn't engaged. It could be that they don't have the staff. It could be that the staff don't have the skills. It could be that actually in that particular organisation, they have significant funding challenges and the funding isn't sat with IT or cyber or whoever else. It's actually sat with another area of the business because maybe the estates are falling apart and desperately need supporting. The picture of how we do digital absolutely depends on the data that we can get out of our systems. This is a limited view. The tooling that Chris will offer you is much wider in scope. And as we start looking at those wider pictures and as we're able to pull that information into regional or national buckets, we can look at better deploying resource to improve the way that we do digital and move information within the health and social care economy. Chris, next slide. Questions?
I think what we'll do, David, just based on time, if there are any questions there, we can, attendees can put them into the question box. So that's great. But David, that was great. Thank you very much. Great to kind of see that kind of regional, higher level view. And I think one thing that I've taken away from that, and it's something that I think we're going to see in a second from Craig, is a lot of this is about context. It's about getting the context of that information, whether it's around compliance or accuracy of integrity of data or completeness. It's about setting that in context in the reporting piece. So thank you, David. That was wonderful. I'd like to now introduce Craig Robinson. Again, Craig will do his own introduction, I'm sure. Craig, I will try and give you mouse control. If that doesn't work, we'll default back to the same with David, but you should have that now, hopefully.
Okay, thank you very much, and good morning, everybody. I'm Craig Robinson, Head of ICT for County Durham and Darlington NHS Foundation Trust. And I'd just like to spend a little bit of time giving you a customer's experience of using the assurance dashboard, kind of where we came from, what happened before we had it, and then the benefits that we've had from implementing the tool. I will try and click through the slides and see whether this works. So there you go. So this is a little bit about our trust, CDDFT, County Durham and Darlington. We have 8,000 staff. We're spread out over 8 hospital sites. We've been a foundation trust since 2007, serving a population of 650,000 people. A very, very busy trust and very geographically spread out. We cover the whole of County Durham, as far north as Consett and as far south as Darlington. In terms of our department, which is health informatics, I'll just try and click forward. There you go. Health informatics. Oh, I'm going too far now. Sorry about that. Health informatics. We have 85 staff supporting 60 plus systems over those 78 sites that we're supporting. We've got IT system users in there, and we provide support to about 8,500 users. That number is slightly higher than the 8,000 because we've got other groups and other organisations that we also support users where we've got shared sites. But I'll go very quickly on to the next slide, hopefully, which, just press the button, I don't want to double. Health informatics, I'm jumping ahead now. So we're in year 5 of a health informatics strategy, which effectively is going to the end point of which will be an electronic patient record. And this was all of our strategic themes and principles which we've been working across for the last 5 years. And we consider that the benefits of the dashboard being fundamental to those to the delivery of that strategy. We've been trying to come up with a balance though between usability on the one hand for the end user, and whilst maintaining the confidentiality, integrity and availability on the other side of the spectrum. And that's a little bit of a difficult balance sometimes to strike, because we can put in loads of technology, we can automate loads of processes, we can patch everything, but ultimately we've still got to make sure that the user experience is a one that is manageable. So a little bit of history before we had the IT health assurance dashboard. Let's see whether that slide is going to move on or whether I'll have to click again. So before we had the dashboard, our visibility was pretty limited. We had loads of different systems, all showing different versions of the same information. The audit trail was spread over. We had the EPO from the antivirus, SCCM, we had the service desk, CMDB, and to be fair, that information was the same information, but it differed in the fact that it was sometimes contradictory and sometimes out of date. Our CareCert process was very manual, meaning that we had to rely on SCCM and other tools to scan for particular patterns of files or versions of files. That meant compliance with the NHS digital requirements became very, very difficult, very, very manual and very time consuming. We had no vulnerability management at all. The only way we could do that was to use SCCM and specifically roll out patches manually. For example, if we knew that Office 2013 had a vulnerability, we could manage that particular vulnerability, but we didn't know if a particular component within Office 2013 had a vulnerability. We had to manually scan for that. It was really time consuming. We didn't really have an idea of what software was installed on our estate as well. Although we did restrict our admin access, there was an awful lot of legacy devices out there, legacy machines, and we didn't know what was installed on the estate, certainly not versions, and whether that had been installed for years and whether it even was still required. We had to trust that suppliers weren't just plugging things into our network. We do use DHCP, but we did have no idea whether suppliers, people were plugging things into our network unchallenged. We did have no idea about that. So what we did, we went to the trust board and we made a business case to get the IT health dashboard, as we call it. After we purchased the dashboard, initially it was all about CareCert compliance. To be fair, that was really the big win, and if it only did that for us, it was going to be a real benefit. But soon, excuse me, I just moved that. Soon. Moving forward there. Soon we realized there were lots of other benefits. So Windows update trends, so we could find out what we were updating, when, how many desktops or servers had been patched or not patched, which was really important for zero assurance. We were getting the Windows assurance as well, so we knew what build our Windows was on. As you know, those who have used Windows 10, there are so many different releases of that. We knew which releases were out there, where they were, and then we could devise a program around that. In terms of toolkit compliance as well, I'll go into another slide into a bit more detail about this, but the compliance with the toolkit became so much easier. We were collecting evidence manually before. We can now effectively run reports straight out of the dashboard. End of support status as well for our zero assurance. We could find out very, very quickly when certain products were becoming end of life. So for example, when an Adobe was going to be out of support, we could actually plan to upgrade that without leaving it in our estate. The vulnerability dashboard we find out that, for example, speaking of Adobe, we'd have 10 versions of Adobe there that have a high risk score, and within very little remediation, we could remove all versions of that Adobe and then take that score down to 0 just by knowing that where they scored and where they generated vulnerability within our organization. In terms of Active Directory, we can see Active Directory trends. So how many ADUs have been created in the last 24 hours, 7 days, number of login failures, number of password changes. You know, we're not looking for routine stuff here, but we're looking for spikes. We're looking for things that are out of the ordinary. And very quickly, we can see a sudden change in trend. We could generate you know, an investigation. One of the things that we never had was Cisco vulnerabilities. Typically, we would put a Cisco piece of kit in and we'd leave it largely untouched until it came to be replaced. Now we can see our Cisco estate as easily as we can our Windows estate, and then we can patch it accordingly. Likewise, with hardware discovery, we now know we use that information to reuse our assets and get the most out of the asset life, so we can decide what we should be replacing first, which machines need attention, and the ones that have got low RAM, that have got failing hardware, we can pull that out instantly. And what we found was that unintentionally, the dashboard very quickly replaced our traditional CMDB. And then the next impact of that was, of course, we started to use that across the whole of health informatics. So whereas it was just used in IT, we suddenly found that our systems team and our information governance team had a great interest in it. So I'll give you some practical uses of where the dashboard's coming really helpful for us. So finding out what our Windows estate is like. So straight away, I get asked on a monthly basis to report on the estate. I can see, there you go, straight away, our Windows 10 estate, 6,427, and we have 29 Windows 7 devices, which I know very specifically, and I can report exactly on those devices. What about the end of life of Windows 10? Well, as you know, Windows 10 has got a number of builds, so we're managing those at the moment. We've got a rolling program of upgrade for our Windows 10 estate. We have a couple of stickling devices on like 1709. We've got 3 devices, and we're managing those accordingly. But we can then roll that program forward. I can get, this is a real-time view. So the last time that those devices were scanned, that information, that dashboard will change, and I can look at a glance how much progress we're making on a day-to-day basis. In terms of DSP Toolkit submissions, before we had the dashboard, it was all files and folders and SharePoint lists. So this is an example of our evidence that we collected when it was the IG Toolkit. We would have to create the assertion, we then create the evidence. Now we use the dashboard, and we can see straight away the DSPT version. We can then click on this link here. I think you see my mouse there. We can click straight on that link. That will take us to an in-context report, either telling us what the assertion requires, what evidence required, or it'll take us to within the relevant piece within the dashboard, so that we can get that information straight out. We can then typically take that straight into a CSV and then use that as evidence. Our IG team or DSP team can also do that. They can go straight into the system and they can collect the evidence themselves, or they can get the assurance themselves. I'll move on to the next slide. It's stuck again. Oh, there we go. We can give it assurance, very rapid, the CRO, very rapid assurance on care certs. So when we get a care cert issued, there's not very many highs come out, luckily, but when a high one comes out, I can give it almost immediate assurance to the CRO that, yep, we don't have any impact on that one. We can sign that one off as complete straight away, or we have a minimal exposure, or we have a maximum. We have a huge exposure. But I can tell the CRO straight away where we stand within that care cert alert. And this example here shows care cert 3968, and it shows that we've resolved it and it was a low risk. And I can go back to any care cert that's ever been published and search for it by number and show what our exposure is. Likewise, with the vulnerability management dashboard, we then use evidence base to decide what we should be doing. So I use the Adobe example because Adobe, my slide's stuck, sorry. Just someone taking control of my screen. Apologies there. Can you move that, Chris? I can't. I seem to have lost control of my of the screen. Oh, there we go. Yeah, sorry about that. Yeah, so the vulnerability management becomes evidence-based. So we can now see what specific CVEs are related to the products that we have installed, and then we can use that to decide that actually we've got a risk score of 5.8 versus 4.3 for that particular version. If we get rid of Adobe Acrobat version 9, we can clear off all of those CVEs and reduce that risk down accordingly. Could you go on to the next slide, Chris? So we also have the detailed executive summary report, which I find personally extremely useful. So I report into two specific committees. One is the Data Security Protection Committee and the Informatics Steering Committee. And I produce this executive report. Well, I say I produce. The system automatically produces for me an executive summary report, which gives us this month versus last month and shows the variance. So I can show those trends. And we've worked with the team at IT Health to actually develop the report in terms of giving us useful and meaningful information. So it's a little bit small on the screen, I apologize, but in effect it tells the executive what they need to know and gives the CEO the assurance that actually we are making progress and where we've got specific areas where we need to take some further action. Next slide, Chris. So some practical uses. So how many PCs have got a single monitor? We use this, for example, when we wanted to upgrade to electronic document management and we needed to put 2 monitors on all the PCs. Well, I needed to know how many PCs only had 1 monitor. So I went straight to the dashboard and I could generate a list within minutes of all the PCs within a particular area that only have a single monitor. I've immediately got a report there. I would have had to send someone round and audit that in the past. PC replacement program. We have a rolling program for PC replacement. I can now build the business case directly out of the dashboard. It's accurate. It gives me lifespan, warranty information. It's all built into the report. I can literally run a report which plumps straight into the business case and tell us which PCs we're going to replace. The next one is device utilization. There's 2 real benefits to this one. One is finding unused assets in the hospital. So where we've got a PC that's in a clinic room that's only used once a week, we can see uptime, boot time, when it was used, when it was asleep or when it was shut down. But also it has been used for HR cases and saying that this person is actually clocking off at 3 o'clock. Yeah, you're right, they are clocking off at 3 o'clock. Or no, actually they're not logging off till 5 o'clock. So there are a couple of benefits on device utilization there. The next one is patch verification. So at the point of the next scan, we can then confirm that the patch we've rolled out has been received and is in place very, very quickly. Next one is last logged on user. So I know we can get this from other places as well within Active Directory, but this tells us if I put in my username into the dashboard, it will show me where I was last logged onto and all of the last logged onto PCs that I used. And we've used this a couple of times in practice where a user has come to us and said, I logged onto a desktop and I can't remember where I've saved a really important file. We said, actually, it was on Ward 1 and it was last Thursday, and they could go back and get that file off the desktop. License compliance. Although we don't use it primarily for license compliance, we use it as a basis for our enterprise agreement return. But more importantly, non-standard software, which might require a license key or might be extremely expensive, we can now verify the number of installs, and more importantly, we can go away and take it off before it becomes a compliance issue. Next one is individual device security review. So this is really helpful looking at a very specific device at the time of repair. So if we bring in a device in for repair, we can look at this screen. It tells us any patches that might be missing, any critical vulnerabilities, any outstanding care certs, and it's all on one screen, which means that the technician can remediate that at the point they've got it in their hand, and they know everything that needs to be done on that machine before they then put it back into the estate. And finally, device history. So I've used a little screenshot on this one, but we have a piece of software which is highly restricted. It's called Offline PMI, which is our patient master index, which we have on a very small number of PCs, so that if we have a complete network failure, we can boot up these PCs and they can look up the patient master index. But what this will do will tell me that this PC had Offline PMI installed on it on the 26th of October at 3:17. Now that might be a perfectly valid installation, but we also need to know who has done that and where they've done it. And by clicking on the Offline PMI, you can also see where else that exists on our estate. So if you have got proliferation or leakage of software like that, or restricted software that a technician might have put on in error, or say, I didn't install that, we know exactly when it was installed, by whom, what time. And that is really, really useful. Next slide. So putting this in, it's not all brilliant, and there are a couple of things you need to consider. So whilst the tool is absolutely excellent, it gives a huge amount of information, it's really important to consider who's going to manage it internally. You need to have some standardized processes. For example, naming conventions on your PCs, naming conventions on your IP ranges, making sure that you're putting good information in and making sure you're standardizing on that. And someone internally needs to be a system manager, if you like, of this system to keep control of it. Moving forward, how do you stop information overload? It is really easy to get drawn into the level of detail in this product. It's not a criticism of the system in any way, but you could be in the system all day. You need to be mindful about what information you want to get out and what you're going to do with it, because otherwise you could be sat in the system all day scrolling through information about devices and the network. The other thing I found is prioritize. It'll let you prioritize which devices you're going to replace first. So you could use that for prioritization. So someone says, actually, my PC is running really slow, but yeah, but you only use it once a week, and this one's used 7 days a week, and actually it's older than yours. So you can use that for that. Non-standard devices. So in the past, we've had a number of medical devices and like media streaming devices for display screens and things. Bear in mind, if you don't enter the credentials into the dashboard, you won't get meaningful information out. So you may need to put credentials in for these. Now, it's really good. You can add in the login prompt. You can add the type of login that the system uses. But if you don't put in the credentials, so you don't have the credentials, it will pick up all the devices, but you'll get minimal information unless you have actually put in the credentials. So you'd be careful about that one. And the final piece of information I would give you is put good information in. If you put good information in, you're going to get good data out. So if you just let it scan your network indiscriminately, you're going to get a load of information there. You know, you need to be able to categorize your device types. So categorize all those TV streaming boxes. I've categorized them all. So now I can look and I can click on that as a category type. But because we put good data in and good VLAN structures and good IP ranges in, we get good information out. That's just a really bit of good advice I would give you from the outset. Get the good data in and then you'll get good data out. I think that's all I've got in terms of slides. Thank you very much for listening. And as Chris said, if you've got any questions for myself or David, we'll happily answer them.
So we've got a few questions that have come in, Craig. I think they're mainly revolving around use of technology. One is around domain and non-domain devices. I'm happy to take that one unless you want to answer that.
Well, it kind of goes on to the last point that I made there. So if it's you don't have to be on the domain. It scans the whole IP range. But if you want to, you've got to put in a set of credentials. So if you've got multiple domains, you can put in an administrator credential into the platform that will then scan, but it needs to have credentials to be able to scan the device. So for example, the media boxes that I'm talking about, if we know that the username and password exists, we can put that in and then it will get it'll read all the information out. If we don't put it in, or it's an unknown domain, it will just tell you that there's a PC or a device on that domain. You get the MAC address, the IP range, and you'll get meaningful information, but you won't get as much.
Right, thank you. Question around care certs and the turnaround time.
Yeah.
Is it instantly in the dashboard, or does it take a couple of days?
It's there pretty straight away. It's not, to be fair, the care certs roll out, well, we sometimes know about the vulnerability before care cert releases it, but in terms of the dashboard, it's pretty reliable. It's pretty quick. We put the care cert number in and it's there. The compliance against it depends on the last scan. So, because we scan continually, so obviously if a care cert came out, say, at 10 o'clock this morning, we may not know our exposure immediately, unless it's historical, because obviously we've got to let the estate scan, and then when we've patched it, we've got to wait until the scan's complete until we know that we're compliant. But yeah, the care cert database, I don't know how often you update it, Chris, but we see it pretty straight away.
Yeah, so just to add to that, we have a process whereby as soon as they're issued, particularly if they're obviously criticals and highs, we get them into a position where we can update all of our customers' dashboards within a very quick amount of time. It's certainly not days, it's a matter of hours, and a very small number of hours usually. And some of them have been out of hours as well. That's then pushed out securely to all of our customers' dashboards, and then once it's done that, obviously the dashboard is scanning anyway, and it will pull that data in very quickly and show you what your exposure is. And I'll pick that up in a couple of minutes when I kind of do a quick wrap up with a short presentation. And the last question, I think you answered this actually, is around clinical devices, and I'm going to cover that as well. Does it track them based on IPs, and would it pick up the vendor and the OS?
It does typically pick up the it picks up the IP, it picks up the MAC address information, and you do get details about it. So, for example, we've got some media streaming boxes that play the radio, the hospital radio across the hospital. We don't have the credentials for those because they're not managed by IT, but they're still picked up as the media device, the manufacturer, the name of the device, and the model of it. So we can then categorize them accordingly. So though we don't log into them from an IT point of view, we know they exist and we categorize them within the dashboard. Same thing goes for medical devices. Each vendor is different, and if we can have the credentials for them, we will put it into the system to get more data out. I don't know if you want to add to that, Chris.
Yeah, no, that's absolutely fine. I think it's a case of how they're managed. I'm going to come on to medical devices, and there's also a question around scanning things like pathology devices. Again, I'll add at this point that this is a non-invasive scan, and the overhead on the networking devices therefore is negligible in a sense. So but obviously any devices that are sensitive, there needs to be a conversation around those to make sure. So I think that was the question so far. I'll pick up on any towards the end if that's okay. But can I just say thank you, Craig? That was wonderful, great presentation, a lot of in-depth content there about how you're using it. I'm going to kind of probably just touch on some of the points that you've mentioned, but that was some great detail, and again, the presentation will be available after if people want to kind of revisit Craig's presentation. But thank you for that, brilliant. I'm going to use the remaining amount of time, kind of 15 minutes or so, just to have a look at a short presentation, kind of give you a general overview from our kind of IT health perspective. But what you just heard from Craig has been replicated in approximately 100 customers across the NHS, covering all different types of organisation, some very distributed, some very concentrated around single locations, all doing very, very similar things, all pulling out that information, all managing that data in a very concise way. As you'd expect, we've got a whole load of case studies. On the top there, you'll see Craig's from Cumbria and Darlington. That was one of the early ones we did actually, but we've got over a dozen case studies now and a couple of video case studies there from Mike and Richard at Nottinghamshire Informatics and Northern Care Alliance, respectively. So I'm sure they'd be happy to talk to you as well. But really, we started out with this journey about 3 years ago, and we were posed a question actually by Mike Press, who was just on that slide previously, about how do we get this holistic view of the IT estate, and how do we make sure that the level of cyber compliance and assurance is accurate and truthful. And we were presented with this kind of spaghetti mess, as the particular organisation called it, of the interrelationships between users, devices, software, hardware, and typically what goes on. And most people in this kind of presentation would go, yeah, we recognise that, we can relate to that. And then of course a whole load of devices and applications that are looking into what goes on across your network. And something that was said earlier that I picked up from Craig's presentation was differing versions of the same information, and that's exactly where we started out with this. How do we get that consistent, truthful view across your network, irrespective of its size and its complexity? And then at the same time, we then layer in things like DSPT, CE+, NCSC, NHS regulations, etc., etc. And how do we get that information into a way in which that can be reported on? Because this is about what you're doing locally, but also you need to report as a byproduct out to those external bodies and also internally within your own kind of assurance frameworks. So we continue to do bits of work around some of those key aspects, and one of them is things like NIS and the cyber assessment framework. But of course, what gets more and more focused nowadays is DSPT. We just recently released version 4 into the dashboard, so you'll see that in a second. And we constantly track this. We constantly make sure that we are able to inform you and provide information via the dashboard of the areas in which that can report on around DSPT. We've already touched on care certs briefly, but the ability to automate the care cert process, irrespective of device, irrespective of the software it runs on, and actually get that information to a point where you can see it very quickly and you can act upon it without kind of going around your network and trying to find out what's going on. And at the same time, set all of that adjacent, one click away from full visibility of patching, OS updates, Windows 10 builds, AV, ATP encryption, etc., etc. All those things are kind of sitting there, and then bring that intelligence into place where it says we can now see where we focus our attention, where we apply our resource at the right time, and how we do that. I just want to touch briefly on medical devices, because this is the piece of work we've been looking at for some time now. Medical devices stroke IoT, OT. It's important to note that these are now in DSPT 938939, and there's a requirement to build out that library of devices and then kind of talk into the process of what you do locally to keep them updated. So this is a piece of work we've got ongoing. We've already written to all of our existing users, say this is a module that will be coming in the next month or so, and enabling you to see medical devices, categorize them in terms of their type, the manufacturer, their OS, the vulnerabilities that exist against them, and of course what versions they are, etc., etc. So that's about to be launched, and you'll have that. And here's a bit more information about that. Again, happy to talk to anybody outside of this forum, just conscious of time, but that's the kind of approach that we're going to be taking towards medical devices and IoT. And of course, as you've already heard, it all goes into a single dashboard that can then be shared with users as required, whether they're part of your organization or not, whether they are part of a specific team, whether you're cyber or whether you are, managing. And clearly, the real benefit of this is where everybody's looking at the same set of information. The key thing here is this is your data. This is your data reporting in a different way. It's done on premise, and this is kind of a very high level way in which it happens. Scanning engine scans the network. It's doing it invasively. It's agnostic. We don't worry about what we find, and it's certainly covering all assets. This isn't just about Windows devices, it's about all assets and all software. There's a level of integration capability that exists. Again, some of the kind of the software that you'll find in the marketplace already. And then we can layer in a whole load of data feeds into the database, and that's when what starts to kind of set out this data in very specific ways, which I'm going to come on to in a second. High level, these are the kind of things that we're doing within the dashboard that are happening across those 100 or so organizations at this moment in time. We've already touched on a few of them, and I'm going to go into these in a little bit more detail, not too much, but cyber alerts or care certs, as we used to know them, DSPT. We've got workflow in here to make life easy, to make sure you can manage what happens and what you find, and then vulnerabilities around a whole raft of different things. ATP compliance is a big one in terms of ensuring that ATP is reporting properly. And then I've touched on some of these already, and we'll go into a bit more detail in a second, and then how that kind of builds together. So what is it? It's actually twofold. One, it's a dynamic dashboard, and I'll explain how that's dynamic in a second. That sits on your network. They say it's agnostic, it's non-invasive. It doesn't worry about size and complexity. It can be multiple domain, and all that is kind of managed from that kind of central dashboard sitting across your network. We have some implementations that are CSU wide, so covering very wide geographies, covering a whole raft. And the largest implementation we've got is in excess of 50,000 IP-based devices. So that's the first bit. The second bit is the service that wraps around that. And again, Craig touched on that in terms of, on a monthly basis, there is a report that's provided to the nominated people within the organization. This view here is the general report. Carries a lot of information. Some people send it straight up the line to senior management. Some people actually take snapshots from it and use it, but it is a snapshot of your estate, and usually the first or second day of the month. In addition to that, we've now introduced an executive summary report, which are those key data items which show changes since last month, which again, from an exec point of view, may be more of interest from that kind of audience. But also around this is what we call this wrapper, and this wrapper is there to take away the need for you to start to say, oh, we need this report, that report. Out of the box, it's very powerful, as you're going to see in a second. But in addition to that, we have a tailoring facility. So we get asked to change the way in which information is reported. Can we add a report? Can we add a new report, as an example? And of course, behind all of that is all of that service around pumping in CVEs, pumping in care certs, making sure your OS is up to date, all that kind of thing is all there in the background, and we keep that all to date and refresh that as things happen from all those data feeds that I mentioned earlier. So how does it work? What does it look like? This is a very general view. It's very consistent in terms of its usage across the whole dashboard, and very, very quickly in terms of navigation, you've got these tabs across the top here. and all these tabs are one click away. I'm going to go into some of them, but all of them. This one here is our Windows Assurance tab. Of course, what you'd expect to find on here on Windows devices. So very quick journey through here. Anything in red requires your attention. You'll have a number against it. And we can click through that, and I'll show that in a second. But we've got what's going on with AV, again, repeat, agnostic. What's going on with ATP, what's going on with your drive encryption. We've got these nice pie charts here, which we've got for both patching status, multi-patching, and also OS. We can strike through these, or we can reform this chart to get into the actual day-to-day view, or all of it. Of course, we want to expose the biggest risk that you've got. And then in the center here, what's going on with updates, and do we have any devices that kind of can't take an update? Do they need to be addressed? And again, one of the things here is interesting is we've been asked to change some of these figures from 1 GB to 10 GB example. From here, you might automate a disk cleanup script as an example. And again, server patching in the middle. And over here, high-level overview of your OSs, and this nice little panel here for Windows 10 builds. This came in a couple of months ago, showing all your builds, showing what build you're on, showing how many devices there, where you are in terms of end of life and end of support, and then below that panel, Active Directory. Devices users not seen, we're tying into your disabled device strategy, so we can manage those as well from that point of view. So a lot of information, but this is just a Windows assurance view. So sitting alongside of that, there are many other views that are very specific, but I say it's dynamic. Why is it dynamic? We can click into a list of devices. Here they are. Here's the 6 devices where we may have got antivirus that's not working, example. We can now kick off some kind of update for these. We could tell it to redeploy the package. And if all those devices are online at that moment in time, then the package is applied, they should all disappear. We may not get that, we may have one that's remaining. And again, this is where we get into that real deep detail that Craig was talking about. What's the summary, even down to things like warranties, what software's on it, what's the performance, uptime, etc., etc. Some people even load documents into here and track the life cycle of the device, and then the security view over here as well, which kind of shows you all of the things that are wrong with that device at that very deep level. So a lot of information. Again, your information all being collated and is being pulled together in a different way to the way you may or may not do it today. It's conscious time. Let's get into care certs. What does that look like? Well, this is a fairly typical view. What this is showing us is top left trending over time, by month, by week on this left-hand side panel here. How many outstanding resolved, high, medium, low. And this is where those updates come in. Now, there's 2 things here. One, we push out the updates as they happen, as I mentioned earlier. We also send the nominated people within the trust an email to say, there's actually one this last week, one came out, there's a new care cert come out, it's got a status of high, it's now in your dashboard, and you can go in, and then what you'll find is that it will be in here, and it will have one of 3 different levels of status. One is the blue radio button, nothing found. Didn't find any of this Drupal in this case. None found, resolvable, there's none outstanding because it didn't find anywhere. The green radio button which says, did find some, but they've already been resolved. We found one, it's now resolved. Or a red radio button which says, yes, we found some and there are still some outstanding. Again, this is dynamic. If I go away for 3 weeks on holiday and I come back and then my machine scan, it's got these vulnerabilities, that machine's going to appear in this list. But again, you can click through this. You can get through not only into the data, the care cert, you can get through into the list of devices that needs to be remediated. So that's that workflow and the automation piece that comes in. Makes it very quick to get to that information. Sitting alongside care certs, we have CVE vulnerabilities, and there's a list. This can be reordered. This is currently showing in terms of software alphabetically. We can reorder by risk. You can reorder by risk. You can reorder by software type, manufacturer, or have you put it on your approved software list? We're finding a lot of customers now are creating an approved list around their Windows 10 Gold image as an example. And again, we can see what goes on in here. We can see how this information affects us. We see what build they're on. We see how many versions there are. We can see how many devices exist on the network. And again, click through to get those devices and kind of manage it from there. And so we can get into the detail of those CVEs and that ranking and how they're ranked from there. We've also got an end of support module. This is information that's provided by the Centre for Internet Security. There's all the software that's available on your network by name, by type, by publisher that's currently announced its end of support or end of life. Has it been extended or not? Gives the dates, how many installed devices you've got or instances of that software, and then a link out to that software as well. We are going to introduce OS into this as well to kind of show you what goes on with those. Cisco vulnerabilities was mentioned. This is part of our hardware vulnerability journey. Again, this is showing you all your Cisco vulnerabilities that are across the network, and then how they rank, what the scores are, and again the detail around those as well. By the way, any of this information can have an alert set against it. So you might want to say, I want to know if we get a Cisco vulnerability, fire an alert, send an email to again the nominated person. And then we have our DSPT module. Excuse me. This is all of the DSPT assertions that are related to assets. This effectively is saying, as an example, the top one here, evidence reference 162. The assertion is the use of personal information subject to data protection by design and by default. What does the dashboard know about in terms of assets? Well, it knows what's encrypted. It also knows what AV is running, and again from that, is there a DLP module applied to that as well? So you've got the ability to see that. You can then click through to view this, or you can export it. Again, saves time in building up that DSPT submission. And again, if you're then audited after that, you've then got access real time to the information that's sitting across your estate. This is probably very small, so apologies for that, but I want to kind of give you a level of detail you can go to in terms of reports. This is a standard report in the dashboard. This is a risk of desktop review, and you can see these devices here, hopefully. This is saying that these devices here, as an example, Windows 7, there's BitLocker disabled. They've got 200 critical vulnerabilities. There's no AV. ATP have got missing components. It's got vulnerable software. It's got high-risk cases. This is a way in which you can start to pull together that high-risk detail and see those devices. This may lead us on to say, actually, we've got a software solution that's at risk here, because all of these are actually connected to our pathology system or our PAC system, etc., etc. Again, we can see things like patching side by side, giving status within 30 days, 30 to 90 days in amber, above 90 days in red. So again, all side by side. Correlation to SCCM shows that gap analysis if we want to see it as well, and then trending over time. This has become really important, trending that information over time. And how does it affect you? Again, more trending here, desktop OS trending, software vulnerability trending. There are so many more of these that are in the dashboard. This is only a kind of a sneak preview of what's in there, but trending, as I say, has become really, really important. And again, the same thing for AD, but more so, how many logons have there been? How many domain admins are sitting there? How many shares do you have across your network? And again, users and computers not seen. There's good reason to have that from a compliance point of view in there. And kind of, as I come into close again very quickly, looking at things like your desktop estate, it's a very powerful view here of what's going on. A lot of information around your desktop estate, even down to, you know, some deep detail about the kind of chassis that these devices are sitting on. And then we see software again. All software across the estate is logged. All hardware is logged. You can then do hardware investigation, as Craig said earlier, and then back up to that top level. We've actually run out of time now, so I'm going to kind of close with this. There's a whole load of things that get used. Craig shared with you some of those good use cases that they're using. There are different ones for different organizations. This is a snapshot again of the kind of thing that people are doing across that. So we've kind of gone past time. It's just after 11 now, so I know people are busy and I don't want to take up too much time. I hope that's given you a view. We will email out to attendees a link to the recording. I haven't seen any more questions come in, so I'm going to kind of close the webinar at that point. If you can complete the feedback surveys you lead, that would be wonderful. Gives a bit more feedback, and we will be in touch, say, with an email with the details of the recording. But thank you very much. Thank you to our speakers, to David and Craig, and thank you for joining us this morning. Hopefully that's been useful and informative. Thanks, everybody. Bye.
Thank you.